Treatment planning is an important part of patient-centred care at St Vincents. Treatment planning helps staff make decisions that align with patients' wishes.
Joan! Hi there, Joan.
Hi Jade, how's Joan going today?
She seems to be a bit off today. She seems to have deteriorated a lot since yesterday. Doesn't seem to be waking up very much this morning. I'm a bit concerned about her. Did you want me to go get the doctor maybe?
Yeah, I think we should, yeah.
Joan, can you open your eyes, Joan?
Hi Catherine.
Hi Jackie, what's happening?
Just a bit worried about Joan. She's just not as awake as she was yesterday.
Okay, Joan, can you open your eyes? Joan, can you squeeze my hand? I'm a bit worried about her. Do you know, does she have an acute resuscitation plan, or do we know what her wishes are?
Not sure.
No, we didn't really talk about it this morning, but I'll go and find her folder and have a look.
Great, thanks.
In critical circumstances, when a patient is deteriorating and could potentially have a cardiac arrest, nurses rely on the patient's acute resuscitation plan to guide escalation of care.
Catherine, I've got the form.
Yes.
So it looks like she's not for CPR, but she is for med calls.
Okay. All right. Well, we need to call a net call. I'm worried about her and we need extra support.
Sure, I'll go and call it.
The acute resuscitation plan is located at the front of the current inpatient history in the white folder.
There are key patient groups that may benefit from having this form completed.
For example, the elderly and frail, those with chronic medical conditions, as well as those with life-limiting diseases, haematological and oncological patients.
On admission, doctors should consider whether a patient requires an acute resuscitation plan.
It's a plan for now, a medical treatment form completed by medical staff on admission, which guides treatment decisions if a patient suffers a serious deterioration.
The acute resuscitation plan is fundamental to patient-centred care. When a patient deteriorates, we need access to the information it contains without delay. Junior doctors are asked to discuss this form with the senior clinician before completing a patient's acute resuscitation plan. If a patient doesn't have an acute resuscitation plan, they may have relevant wishes expressed in their advanced care plan.
In palliative care, patients have often begun the process or come to us with an advanced care plan completed. An advanced care plan is a plan for the future. It's completed by the patient and is valid for multiple admissions. An advanced care plan ensures that we know what is important to someone and that their voice is heard. An advanced care plan states the patient's values and preferences. When the patient is no longer able to make decisions about their care, the advanced care plan can help guide medical decision making. A patient may express their resuscitation wishes in an advanced care plan, and this can inform an acute resuscitation plan. An advanced care plan contains the name of the patient's alternative medical treatment decision maker. It's recommended medical practice that you ask your patients if they have an advanced care plan and if they have a medical treatment decision maker. The documentation that supports this can be found in the legal tab of MRO.
All patients with a serious or chronic medical condition should be offered the opportunity to complete an advanced care plan. Each unit will develop a strategy outlining their approach to advanced care planning. A team member will be nominated to be the unit's champion. When you see a patient who you think will benefit from an advanced care plan, contact your unit's key champion to discuss the next steps.
This can be a delicate conversation, which is usually started by asking the patient if they have an advanced care plan.
Patients are generally led through the conversation about advanced care planning. It may take multiple conversations before the patient is ready to record their wishes.
All of these conversations should be recorded in the Advanced Care Planning Discussion Record in the Legal tab in MRO. St Vincents offers clinical staff a one-day skills session on how to have an advanced care planning discussion with patients.
It's such a comfort to have an advanced care plan. I've got cancer and I'm on a one-way journey and I get to have my say. So I know what's going to happen and my family know what's going to happen too. So it just gives us peace of mind.
St Vincent's prides itself on patient-centred care, and these two key documents, the Acute Resuscitation Plan and the Advanced Care Plan, are integral parts of our quality of care. These two important guiding documents are patient-focused and complementary. We need to offer our patients the very best in care, and these two documents help us to achieve that goal.